Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni and here's what I bring to you from the world of medicine. Study reveals incorporating metastasis-directed radiation therapy enhances progression-free survival in patients with metastatic pancreatic cancer. In a recent study published in the Journal of Clinical Oncology, researchers from the University of Texas MD Anderson Cancer Center demonstrated that adding metastasis-directed radiation therapy to standard of care chemotherapy improves progression-free survival in patients with oligometastatic pancreatic cancer. At a median follow-up of 17.3 months, PFS was 10.3 months in patients who received metastasis-directed therapy plus chemotherapy compared to only 2.5 months in those who received a standard chemotherapy treatment. Additionally, increased immune response from MDT were connected to a longer survival times. Metastatic pancreatic cancer spreads rapidly to vital organs, posing significant challenges for disease management. Diagnosis often occurs at an advanced stage, reducing treatment efficacy and decreasing survival rates. The disease's complexity and resistance to many therapies also contributes to its poor prognosis. Chemotherapy, the main treatment option, generally offers a 7-month average survival time before disease progression. MDT targets metastasis with high-dose ablation radiation therapy, aiming to eliminate all cancer cells at all sites identified on a scan. This approach is primarily being evaluated for patients with oligometastatic disease for whom imaging shows 5 or fewer metastases. Oligometastatic disease is often described as an intermediate stage of cancer between a localized tumor and widespread cancer. The median time to new lesion reoccurrence was 14 months in MDT arm versus 5 months in control arm. The 12-month freedom from new lesion reoccurrence rate was 54% in the MDT arm and 38% in the control arm. Crossover from the control arm to MDT was allowed. MDT, which primarily consisted of high-dose ablative radiation therapy, was very well tolerated with no grade 3 or greater adverse events related to MDT observed. The study's exploratory endpoints aim to investigate the effect of MDT on body's immune system following earlier research demonstrating its potential to boost immune response. The researchers found that systemic immune activation events were associated with MDT and correlated with improved PFS. The results suggested that metastasis-directed therapy is effective and safe for patients with oligometastatic pancreatic cancer. Nevertheless, larger trials are necessary to confirm the survival advantage observed with metastasis-directed local treatment and to investigate systemic immune activation as a potential mechanism for therapeutic benefits. That's all for today. Thank you for watching Medical Dialogues. Stay tuned for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.